Assalamualaikum to beloved lecturer, Professor MADYA, Dr. HADI SHAFIE, and fellow friends. Today, my group will be present group work using MI. For introduction, for the general means of group counseling, there are many times in our life when we all really feel we need someone to listen to us. This is basically what counseling is, someone to listen to you. The purpose of counseling is to enable you to resolve your issue so that you can have more happiness and joy in your life. In the counseling session, the client can explore various aspects of their life and feeling, talking about them freely and openly in a way that is really possible with friend or family. Group counseling. What means group counseling? Place where you can experiment with different way of behaving. Second one is sharing experience, people experiences. You will have a change to compare them with your own. And make a therapy, that's mean which posit that people benefit from shared experience. Idea that's dealing with specific issue may cause isolation and a feeling that one is alone in facing one's problem. Comforting, people with similar trouble can be comforting to each individual. And the last one is learning about yourself. Meet together regularly to learn more about themselves and how they relate to others. Advantages of using group counseling. Providing unique environment, the first one. Learn about and experience both self and others. The second is exploring the issue in depth. Give individuals an opportunity to explore their issue in more depth. The third one is avoiding isolation and loneliness. Contract this isolation by assembling people with similar issue. The fourth one is highly organized. People doing specific activity together and then sharing the result. The next one is group counseling costs less. Better alternative than private therapy because it tends to cost less. The next one is help others and being helped. Opportunity to help others as well as being helped. And the next one is feeling of empowerment. It's help build confidence and self-esteem. The second last is improvement by sensitivity and insight. That means improve from the sensitivity and insight. The last one is promoting growth and change. That means provide different perspective. For conclusion, group counseling is indeed a very effective way to solve one's problem. It's a process through which several problems can be tackled properly. In order to carry out effective group counseling, one should keep group member respect and dignity in mind. The definition of counseling in a nutshell is that a counselor is guide to you help uh, to understand your issue, to guide you through them, and to help you learn to do it on your own. That's all my part. I will pass to Mrs. Haiza to continue. Thank you.
Thank you, Encik Mustaqeem, for presentation previously. Okay, Assalamualaikum warahmatullahi wabarakatuh and very good morning to our Honorable Professor Madya, Dr. Amin Al-Hadi and to all my friends. I'm ROHAIZA and I will continue with my part foundation about motivational interviewing. Okay, motivational interviewing also stands for MI is a counseling approach developed in part by clinical psychologists William R. Miller and Stephen Roenick. It is a directive, bias-centered counseling style for eliciting behavior change by helping clients to explore and resolve ambivalence. Counselors attempt to influence clients to consider making change rather than engaging in non-directive therapeutic exploration. The examination and resolution of ambivalence is central purpose and the counselor is intentionally directive in pursuing this goal. Motivational interviewing engages client, elicits change talk, and evokes patient motivation to make positive change. By this, motivational interviewing incorporates the idea that every single patient may be in differing stage of readiness level and may need to act accordingly to the patient levels and current needs. Change may occur quickly or may take considerable time depending on the client. The incorporation of motivational interviewing can help patients resolve their uncertainties and hesitancies that may stop them from their inherent want of change in relation to certain behavior or habits. Okay, now we see conceptualization of how change occurs. Okay, first element is ambivalence about change is normal. Second, change is often non-linear. Third, attend to readiness in your work. And the last element is readiness is not static. Next, elements of MI. Motivational interviewing contains several important elements. For the sake of clarity, focus on 4 MI principles: OARS, change stop, and MI spirits. Unique to MI is how these elements are combined, the timing of how they are used, and their application in effort to evoke change stop. For principle of MI, Rolnick expressed this principle using the acronym RULE. R stands for resist the writing reflex. U understand your client's motivation. L listen your client. And E empower your client. Okay, for foundation skills, these skills are conveyed by the acronym OARS. Open-ended question, affirmation, reflective listening, and summarize. Eliciting client change stop. Okay, specifically designed to evoke this kind of language and reinforce it when it occurs. Okay, for spirit of MI. Okay, the final circle represents the guiding philosophy that inform the principle, the use of micro skills, the application of other intervention and techniques, and the elicitation of change stop, collaboration, counselor knowledge and client experience. Evocation, counselor facilitate client to evoke motivation to bring about behavior change, and autonomy, counselor recognize the decision to change come for client. Okay, thank you. That's all for my part. Our presentation will be continue with Cikgu Asma. Please welcome Cikgu Asma.
Thank you, my friend, Madam ROHAIZA and Mrs. Ahmad Mustaqeem. Assalamualaikum warahmatullahi wabarakatuh to our beloved lecturer, Prof. MADYA Dr. AMIN Al-HADI. Okay, now is my part, application of MI theory in group counselling. Adaptation to various settings at dual psychological addiction disorders, managing chronic health condition, weight management, domestic violence, sexual offense, adolescents and young adults, mandated substance abuse treatment, integrating MI and TTM for cocaine abuse, MI empowerment groups for women with multiple problems. Motivational interviewing group have a 4-phase model. First, engaging the group. Second, exploring perspective. Third, broadening perspective. Fourth, moving into action. Structuring MI groups. Group types such as support group, psychoeducational group, psychotherapeutic groups. Structured to unstructured. Homogeneity versus heterogeneity, time limited versus open-ended duration, closed membership to open enrollment. Blending MI and group practice, integrating MI concepts, strategies, and techniques into MI groups. such as the challenge of being person-centered in a group of people with competing needs interests. Using MI technique in MI group such as OAS, providing information, giving advice, and others. Using group therapy technique in MI groups, facilitating such as disclosing, linking, redirecting, protecting, rounds, diets, written, dramatic, and work exercise. Motivational interviewing in group through various staples in Journal of Group in Addiction in Recovery 2006 can be advantageous to have two counselors or two counselors for one focus on reflecting while the other counselor focus on process. Taxing to sustain both. Okay. Present style and spirit of MI when opening, such as group rules, collaborative approach with open. Open means O for open with group purpose, learn more about group thoughts, concerns, and choice. P for personal, choice is emphasized. E for environment is one of respect and encouragement for all members. And for non-confrontational nature of the group. Okay, this one is video about group presentation. Okay. Conclusion. Working in MI style in a group use the same skill. The key is to elicit from the group and its members some shared recovery term. Work collaborative with the group has the whole linking common term and relating to the big pictures using OAS. Preparing for change has a group while acknowledging different stages of change, enhanced link and mutual affirmation or support. Support positive shared group values to highlight descriptions to elicit change talk. Okay, thank you. This is our different. Thank you from our group. Assalamualaikum warahmatullahi wabarakatuh.